How are you, Dr. Ryan?
Okay, you have unmuted me. I can hear you now. Can you hear me?
Yes, I hear you. How are you?
I'm good, thank you. I can see Mike and Natasha there. Hi, guys. You're still muted at the moment.
I will make them co-host for me.
Yep, please.
Okay, and I will make you also.
Hi, Mike.
Good morning. It's great to see you guys. Fantastic. Beautiful day in Colorado.
Is it? It was evening now in Singapore and getting hot again as normal. You know, getting to the hot time of year, monsoon coming. Hi, Nat. How are you?
Hi. Hi, guys.
How are you? How are you,
Mike, right? Nat, you and Mike know each other, right?
Yes. Well, I know of Mike.
Yes,
Mike is very, very popular.
I know of you.
Very popular. Oh, that's nice to know.
Of course.
Yeah. Thanks a lot, Mohamed, for letting us come today.
So, Mohamed, when do you want us to start?
After 1 minute, we will start. My name is Mohamed Ashraf. I am the host from Egypt with Dr. Mohamed Nabil. Welcome to you, Dr. Ryan. Welcome, Dr. Michael. Welcome, Dr. Natasha. We are very proud and very happy to join you in an amazing and fantastic event for veterinary doctors in Egypt, and all of Egyptian veterinary doctors are waiting for this event. I hope they will be happy to listen the new guidelines for pets, COVID-19 and pets, what is the new updates for this topic. It is very important for all veterinary doctors and veterinary owners, and sorry, for pet owners. So we want to know what is the updates for these topics and what is the advice for animal welfare for veterinary doctors. And I am happy to listen for you, Dr. Chain, to introduce the WSAVA and to our colleagues and to start our event. You can start now, and we are listening for you.
Okay, Mike and Nat, I'll just give a quick introduction and then I'll pass it over to you, okay?
Okay.
I hope you can see that, everybody.
Yes, I'm seeing it.
Okay, excellent. My name is Shane Ryan. I'm the president of the World Small Animal Veterinary Association, and I'm going to give you a very brief introduction to WSAVA before we introduce our two speakers of this evening. If I can get my screen to work. Here we go. WSAVA, we're an association of associations. We do not have individual membership. We have currently 113 member associations from all around the world, representing well over 200,000 veterinary professionals. We don't yet have an association from Egypt, so I hope that will change in the near future. Who are we? We are a global community. We like to think of ourselves as a global community. And the purpose of this community is to ensure that all companion animals everywhere in the world receive the veterinary care that they need for their optimal health and welfare. It's a big, bold vision. And to achieve this vision, we have our mission, and that is to develop an educated, committed and global collaborative community of veterinary peers. And this is why we're out here this evening to do this educational process. How do we accomplish this mission? We have 4 pillars of activities, 4 core responsibilities that we take on. They are global education, standardisation and global guideline projects, One Health initiatives, and animal wellness and welfare. And I'll just very briefly touch on these before I continue. With the global guidelines, we have many of these currently and more in process. Our most popular ones internationally at the moment are our vaccination, nutrition and pain management guidelines. We have most recently produced our latest guidelines, which is our list of essential medicines for cats and dogs, which is particularly useful in regions or in countries where you may have difficulty accessing essential veterinary medicines that you require to practice as a competent veterinary professional. The previous ones before that, which both Natasha and I worked on, were the animal welfare guidelines. These are relevant for your everyday practice, and I would encourage you to go and have a look at them at the WSAVA.org website. But the reason we're here tonight is one of the other core pillars is continuing education. And the purpose of our continuing education mandate is to encourage learning and professional development, certainly of companion animal practitioners, but more importantly, enable our member associations to develop their own self-sufficiency in continuing education programs. So we don't want to be here doing this forever. We want to encourage our local members, our local veterinarians, to take up the torch and run the continuing education programs themselves to ensure that their members have got the latest information available. The last figures that I have to hand was in 2018. We had 40 meetings worldwide, which had over 4,000 delegates. That's face-to-face meetings. We had a very large number in Africa, and we worked with the WSAVA Foundation, with AFSCAN, which is the African Small Companion Animal Network, to expand WSAVA CE in Africa. We don't do a lot yet in Northern Africa, but we hope to be able to do more in the near future. So tonight, continuing on to that, our global education effort this evening is this COVID-19 webinar. We have two excellent speakers this evening. We have Professor Michael Lappin from Colorado State University, and we have Dr. Natasha Lee from Malaysia. Now I'm going to have to go to presenter view to see the write-ups here. So Professor Michael Lappin, I hope this works, here we go, is a small animal internal medicine specialist from Colorado State University. Dr. Lappin studies infectious diseases of dogs and cats and is currently the chair of our WSAVA One Health Committee. So that's another one of our core pillars. He has been working very closely with others during the COVID pandemic to try to provide accurate information to veterinary care providers and pet owners concerned about their companion animals. So tonight he'll be speaking on SARS-CoV-2 infection in companion animals and the risk to pet owners and veterinary staff. Our other speaker this evening is Dr. Natasha Lee, and Natasha is a veterinarian from Malaysia with over 15 years of experience in animal welfare. She has managed large companion animal projects across Asia for World Animal Protection, and has also led a campaign to include animal welfare science into the veterinary curricula across Asia by providing training to more than 125 veterinary schools. She currently runs an animal welfare consultancy and works with other organisations to carry out the management, monitoring and training in animal welfare. Natasha is the Vice Chair of the WSAVA's Animal Wellness and Welfare Committee and is on the International Advisory Board for the Alliance for Contraception in Cats and Dogs. So without further ado, I'll pass you over to Michael to speak this evening on SARS-CoV-2 infection in companion animals. Michael, please, over to you.
Thanks a lot, Dr. Chen.
I can stop screen.
All right.
Michael?
Thank you very much. I just need to switch over the screen share.
Okay.
Thank you, Dr. Chen. It's a great honor. But you mentioned that Egypt is not a part of WSAVA?
That's right. Not yet.
We will, Dr. Chen, with you. We are planning to make it with you.
We would encourage you to join us and join our community. We have our meeting, our annual meeting this September, and I think if you're going to apply for membership this year, you would need to do so within the next couple of months, and we can certainly give you the details on how to do that.
Okay.
What should we do exactly, Dr. Chen?
If you contact me, I'll let you know.
Okay, I will contact you.
Okay.
Dr. Michael?
Dr. Michael.
Yes. Very good. Thank you very much for that great introduction, Shane. And that's very exciting to hear the conversation about potentially Egypt ultimately joining us with WSAVA. That would be fantastic. I've got to admit, I'm very, very sad to be in Colorado and not in Egypt to meet you in person. It's been one of the places that I've not ever gotten to visit in my life, and hopefully in the near future we'll be through this pandemic and we can all be together again. I've been working with the One Health Committee for a number of years now and look forward to sharing with you some of the opinions from our group as well as other groups around internationally about this virus, the SARS-CoV-2, that causes the syndrome in people, COVID-19. As we've just heard from Shane, we're very fortunate to have a One Health Committee, and sad to report that our founder has left us now, but Michael's dream was to have a One Health Committee, and I was quite honored to be invited to be part of that from the start. But most importantly, I wanted to share with you that we have representatives from the CDC. Casey Barton-Baravesh is part of that American Center for Disease Control. She's in charge of the Healthy Pets, Healthy People. So that gives us quite a lot of strength having the access to that group. And then Gregorio Torres, who's worked very much with rabies, is our representative from OIE. So we feel very fortunate to have their organizations represented on our committee, but we're also fortunate to have 2 medical doctors, and so we're really working hard on the whole One Health concept. And now that we know that SARS-CoV-2 is a reverse zoonosis, meaning the infected person can infect a companion animal, now that we know that, this is truly a global One Health issue. But before I move on, I do want to emphasize that there is still to date no documented case where the owner infected their dog or their cat. There's no data that suggests that that dog or cat passed it on to the next person. What we're hopeful is that will continue over the pandemic and may relate to the fact that they may not be shedding enough virus to infect the new person for a very long time period. And I'll show you some information that supports that as we go through my part of the lecture today. This is such an important welfare issue as well, and so I'm quite honored to get to speak with Dr. Lee and Dr. Ryan because of their great work. What we'll emphasize at the end of my talk and then build forward with Natasha is that these animals are probably of minimal risk to the next human, and so their rights should be protected. We don't want them being relinquished. They don't need to be put out on the street, and I'll show you some of the recommendations and why I say that. But again, very nice to be with you. And now I'll spend about 28 minutes talking about some of the issues that we know, mainly about dogs and cats in today's webinar. We were very excited to be part of the American Association of Feline Practitioners event, the Zoonosis Guidelines. I happen to chair that committee as well, but we were quite honored to have WSAVA as well as the International Society of Feline Medicine endorse our guidelines. We'll be posting a video statement on the AAFP website next week discussing the SARS-CoV-2 virus as a reverse zoonosis. But I think what we're all doing together today is trying to make sure that accurate information is available to people all around the world. And so working with WSAVA and ISFM, the feline groups, it's really important because all those access points can get information to vets as well as hopefully to owners. We always have to start the science part of this discussion with, we might have to change the lecture tomorrow. It is amazing how much new information comes even on a daily basis. And I always start my day with some of my friends like Dr. Ryan in in Singapore, Vanessa Bars in Hong Kong, a lot of our members in the European continent. I'm always starting my day here at 6 a.m. in Colorado reading about the new discoveries. And so please remember, keep up with the different postings from different educational sources and scientific sources, because these things certainly can change. I'm glad we're recording this webinar so you can go back and look at some of these slides in greater detail because of our short timeline. But I do believe that WSAVA, and working with that particular group, I believe that we are doing a good job distilling this massive amount of information into easily readable, at least in English, and then translated into multiple other languages, the information that's important. What we're doing on our site, I'll show you in a few minutes, is getting the information, hopefully, to those 113 members, and then they disseminate to all the veterinarians. But I do believe that WHO, the Center for Disease Control in America, with our international angle as well, and then OIE, are probably some of your safest places to evaluate information. The ProMed group is also very good for finding new things quickly, and so I check that one pretty much every day to see what's new with this virus. And then our International Society of Companion Animal Infectious Diseases also has many of the WSAVA committee members, like Scott Weiss in Canada. He's involved with ISCAID. I'm with ISCAID. Jane Sykes from ISCAID is also on continuing education for the WSAVA group. So many of us around the world are attempting to give you accurate information. So until recently, Dr. Michael Day, Mary McCondas, we were the team gathering the information to post on the WSAVA website. But if you would visit our COVID-19 advice and resources area, we do have those materials reviewed by Casey and Gregorio, our CDC and OIE members, and try to get things to you fairly shortly after new discoveries are made. And in fact, after our webinar today, I'll be finishing this week's E-shot, which is basically what's happened with this virus in dogs and cats and other companion animals within the last 1 to 2 weeks. So I'll share to you today what's happened recently as well, but that will then ultimately be posted on this website. I do want to mention the ISCAID group, since many of our members on the scientific community for WSAVA are also part of ISCAID. And so obviously many groups making recommendations around the world. But this one's an interesting group because we do have members from Europe as well as Asia, as well as the United States, distilling information. And in fact, this week, we just posted our recommendations for cats, and I'll share some of those guidelines with you today. But let's start with this new virus, and you're in the area that had MERS a few years ago. We had our SARS-CoV-1 in Asia and several other countries back in 2003, 2004. So we've been familiar with the beta coronaviruses of people for a number of years. But this new virus, it's really important that we remind our owners and then some veterinarians that think it could be directly related to our regular cat and dog coronaviruses. And it's not. This coronavirus, which did jump from an animal, probably the bat, this coronavirus prefers people and is mainly transmitted person to person, with the occasional transmission to a companion animal. So again, the syndrome in people is called COVID-19. The virus is SARS-CoV-2. In the early stages of work with companion animals in particular, There was a lot of confusion because not everybody understood what the test results may mean. Now we have more tests available, and many countries like North America are now applying those, not just to people, to try to slow the pandemic, perhaps determine when people should go back to work, but we're also now using it limitedly in dogs and cats, as we'll talk through the lecture today. But just to remind you, when antibodies develop, that generally means the virus has entered the body cared that it was there, and so we can use antibodies to prove prior exposure. And sometimes those antibodies also correlate to immunity, which is what we're attempting to determine now for dogs, cats, and people. The virus isolation is still always the best to prove that there's currently an infection, because that proves the virus is alive. And this is where, in the early parts of the pandemic, it's much easier to do polymerase chain reaction, in this case, quantitative reverse transcriptase, PCR. That's quite easy to do, and so everybody in the world is now doing those assays, and probably appropriately, including Colorado State University. But remember, those viral nucleic acids, they don't always mean there is still live virus. A good example is in some of the early data from cruise ships where the people were trapped and having the syndrome while they were on those boats. They were reporting things like the virus being on handrails for out to 17 days. Well, that was nucleic acids, RNA of the virus, not necessarily live virus. And so now we know a lot more as different groups that can work at the biosafety level 3. Remember, this is a dangerous virus. But those that can work at the BSL-3 level now can do virus isolation. And we're getting more information about how long people shed or pass the virus, as well as domestic pets. You know how we're always thinking in our lives when something important happens, what were you doing? I'm not sure what Natasha and Shane were doing on December 30th when this first posting came out from ProMed, but I was at the bottom of the United States Grand Canyon. So I came out of a hiking trip to a global pandemic. It's pretty crazy. But isn't that numbers amazing? These are from yesterday at WHO, with now over 4 million presumed cases. And so this experience has been a little bit different than MERS in the Middle East. This one's been a little bit different than SARS-CoV-1, with unfortunately now being a global pandemic. But I wanted to make sure that you keep these numbers in mind as we shift to dogs and cats now, because in contrast, the numbers of proven dogs and cats with the infection are minuscule. I really think we should continue to emphasize to our owners and our staff that this is a human disease. And so when I go to the clinic later, I'm going to be wearing my mask just like everybody else in the building to lessen people-to-people droplet transmission. And I'll show you our current guidelines for handling the pets before we finish the lecture. So this was a very interesting paper that's been debated a lot already. What was the jump from probably the bat into the human? So there was some discussion about feeding those tissues to dogs could somehow have related to the ultimate pandemic. That will be debated, I'm sure, for years. Congratulations to these authors. However, it's probably not clinically relevant, and dogs seem to be less permissive to this virus than cats, people, or ferrets. So again, the dog is really kind of dropping lower and lower on our concern list. I don't know if there have ever been 2 dogs with more words written about them in the history of the world. when the Hong Kong team started quarantining the pets of people with COVID-19 and doing repeated testing, that first Pomeranian and then the German Shepherd dog to follow generated a lot of information. And then, of course, one cat of the 18 tested repeatedly ultimately was positive. So this data does support my statement earlier that if a person is actively shedding SARS-CoV-2, remember these people all had COVID-19 illness, it could be at a level that could infect some animals. But please look at the ratio of positive animals to those tested. Again, in that 5% range, even if those pets were living with a currently ill person before they were quarantined. That actually, first data from the dogs actually made it into Nature just yesterday or the day before. So congratulations to our friends in Hong Kong for that program. And then, of course, in the United States, we got all excited when our first pug with SARS-CoV-2 was reported. And we were talking about this with ISCAID just a couple of days ago. We're getting close now. Well, we'll probably quit having a press release for every single positive animal. We're now up to 7 cats and 4 dogs proven as a reverse zoonosis to be infected. So probably we don't have to have a press release for every one. We know that it can happen. But as we test more dogs and cats, I think you'll learn, like we're learning in the United States, that even though it can happen as a reverse zoonosis, it's actually not common and not easy compared to what we see in our 2-legged animals. The Bronx Zoo large cats led to a lot of excitement, and multiple cats on that exhibit that had some of the respiratory and gastrointestinal signs. Some of those cats, in fact, the initial 7, all did ultimately become positive. But I have been encouraging domestic cat veterinarians to remember that the captive cats generally are inbred, which is why they're often predisposed to things like feline infectious peritonitis virus. And so when we talk about cat-to-cat transmission, I think we should keep the big cats in their own group and focus on domestic cats. I don't think they're the same because of their genetic pool. Now, the Chinese work was fantastic, and it was great to see that published recently in Science. And then if you've been following the experimental infections, so this work does confirm if you give a high enough dose to a cat, a dog, a ferret, they can be infected, with cats and ferrets being more permissive. So we know that can happen, and we know it can transmit to the next generation of animals passively housed with them. No denying it, this is a reverse zoonosis. This is the most recent paper from 2 days ago in the New England Journal of Medicine. But I wanted to show you these bars, the blue bars being the primary. The secondaries are then in the tan colored bars. So this does show if you inoculate them, they will shed, and they will shed enough to infect the next cat. But this is not PCR. This is virus neutralization, so truly the virus is alive. And so while it happens, it does appear that at least healthy research cats, the shedding is short-term. And so that's what's very important for us to factor into our management of our practices, is what should we do with an animal that could have mild respiratory or gastrointestinal tract signs. We now need to factor that in, because while there's still no information that suggests that these cats are shedding enough to infect the next person, that is theoretically possible in a small number of cats. So we do need to be careful, especially with pets that are coming from a household that likely has COVID-19, those cats and ferrets and dogs should all be cared for carefully to try to lessen transmission. But I do want to emphasize again at this point, this is a human-to-human disease, that these guys are probably infected by mistake, living with people, having prolonged direct contact, and then they will be short-lived in their shedding periods based on the current data. So do we believe that it's common or important? The jury's a little bit still out on this, but we do believe at the ISCA, the International Society for Companion Animal Infectious Diseases, we believe that those animals that you're getting ready to see on clinic duty tomorrow, if they've had clinical signs longer than 14 days, those cases probably are not related to SARS-CoV-2. Those that have been sick less than 14 days, then we want to have a lot of information from the owner. Does that family likely have COVID-19? Because remember, dogs and cats are probably not shedding it amongst themselves very often. It's probably more important that they acquire the infection from close contact with a person showing clinical signs. The good news on that area, two of the big commercial labs in America started testing animals very early in the United States, the ones that had respiratory signs, a little bit on the gastrointestinal side. And so far, only 2 positive animals have been found in areas of the United States that have a lot of COVID-19. And those are 2 of the 7 cats that have been reported positive around the world at this time. This is a paper that I use with veterinary students because we're all a little bit afraid right now. We don't want to acquire this infection. But in this closed group of veterinary students, where there were 2 students that were definitely carrying the virus, the 9 cats and 12 dogs that lived with those students did not become positive. So even though it can happen, and experimentally when we give a large dose, we can certainly infect a cat or a dog or a ferret, it appears that that's a little bit unlikely in a situation in nature. But it definitely could occur. But just to state it again, even if a pet was potentially positive, the odds of giving it to the next person is relatively low. But because of the potential risk, we do recommend that people that are being self-quarantined because of having the virus or appropriate signs, they should sequester themselves away from their pets as well, because we do want that family's infection to stop as soon as possible. So at this time, we do have the tests available for pets in many countries, but we are being regulated. We can't just send samples, and the building that tests for this virus is right next door. My lab does the PCRs on research samples. But point is, we do limit the number of animals that are tested at this point, and our public health veterinarians in the state of Colorado, here where I live, they have to give us approval to test a pet animal. But that varies by the country, and so those of you with us today will have to struggle with those decisions yourself. Do we believe that it's actually a giant clinical problem in pets, meaning a common cause of upper respiratory infection signs, common cause of gastrointestinal signs? Right now it appears probably not, but we do need additional data. So again, these regulations are going to have to come from each of our individual countries, and it is nice to see those things now being released. Here's the new guidelines from another of our international countries just in the last several days. Now, ISCAID, our group is an infectious disease international consortium. As I mentioned, almost all of it. This group of international experts, which includes Europe, Asia, the United States, and the United Kingdom, as well as Canada, have concluded that there's probably not a lot of benefit currently of testing individual cats because of the short duration of infection, the fact that most of these pets have not become infected, most have not become clinically ill, and we don't currently have any specific treatments. Remember, this is just a virus that's going to run its course. And so we are making these types of guidelines available internationally. And if you'd like to see the ISCAID guidelines, they were just updated 2 days ago. Now, WSAVA, which of course most of our members on ISCAID are also WSAVA members, like myself. This was a great group of information published with the input from Mary and Michael Day from the Vaccine Guidelines Group. Early in the pandemic, there was a lot of concern about the dogs and the cats. And since there are some coronavirus vaccines in certain countries, then there was a thought, oh, maybe that will lessen the risk of SARS-CoV-2 to people. And that is actually untrue. So using the enteric coronavirus dog vaccines that are available in some countries, or using the temperature-sensitive mutant FIP vaccines that are available in the United States and a few other countries, there is no indication to do that, trying to lessen this particular virus. They're too distantly related. There will be no benefit for that. But the other nice thing about this particular guideline is that we also talk about what to do during the times that routine care is shut down in clinics. What do we do if we miss vaccinations, especially in puppies and kittens? This guideline is giving you a lot of information about that topic, and I'll refer you to that publication. Of course, we really want to protect our staff. This is a human disease. Human to human is most important. But since we can have transient shedding, potentially, by dogs, cats, ferrets, we did have to work on guidelines to help veterinary clinicians, and I'm sure in your country as well. We have to decide how to best protect our staff. And so that really starts with asking a group of questions about people. This is a people disease. And so if there's been no evidence of clinical disease, potential exposure in that family, then there's probably very little risk to your staff. And so this is just one example that was published in the Americas, how to use the history from the family to make a decision tree on how to protect your staff. Remember, we're attempting to keep people from becoming ill with this virus. So please check out the published in Clinician's Brief. But we all have to then tie it into our own countries, our own situations. Sometimes there might even be local laws that apply. I just thought I'd show you our brand new document from Colorado State for how we start our cases. We still are sequestering the owners to the parking lot. They don't come into the building. And so we are then asking the 4 classic questions, which now also include, is there any pet disease? And if they're within 14 days of having acute respiratory or acute gastrointestinal, we actually factor that in to how we handle them once they're in the building. So I'd be glad to share with our team today our Colorado State guidelines in the future. But we do have to conserve our PPE, or personal protective equipment, so we want to make sure that we appropriately protect ourselves in high-risk cases. But in those that are low risk to our faculty and staff and students coming back on June 28th, when we're trying to protect those people, we do want to also do it logically, because if we use our heaviest protective devices for low-risk animals, then we don't have enough in the human profession as well as for our higher risk. And so the last couple of things for me, getting ready to set you up, Natasha, for coming to join in. This particular, I think, is really important. We're at risk because we interact with people. A little bit smaller risk because we interact with pets. So we're only in the top 20 or so of potential risk. And so if we do the appropriate social distancing, we all wear our masks in the hospital now. When we get closer than 3 feet, we wear our safety glasses, like when bleeding an animal. Hopefully we can lessen the person-to-person part of this particular disease. And then as we go through the summary slide, it's really probably an uncommon for your pet to be infected by you. They do seem to get lower doses from our exposure, but while you're sick, if you have this virus, no cuddling with those pets. Let them social distance away from you in the home, just like your children. And then within that 14 days or so, probably everybody will be fine again. So right now, I hope our bullet 3 continues. I hope that continues for the next several months, but so far, it's not been documented. So again, the pets will be self-limited, you'll be self-limited, and hopefully everybody will come through this epidemic together. So please check out our websites at WSAVA, and I'm very much looking forward to hearing our next speaker and continued discussion about this and animal welfare. Thank you very much for listening to me today.
Thank you, Dr. Michael. I hope to see you soon in Egypt. And I will invite you and Dr. Cheney and Dr. Natasha to visit the pyramids together. And we hope to reconnect again and hope to see you in Egypt very soon.
Thank you, guys.
Thank you. Thank you very much for your helpful data. Natasha?
Okay, thank you.
How are you?
I'm good. Good. How are you guys?
Oh, good evening. Good evening or good morning. What is the time?
It is now 9:40 p.m. at night here in Malaysia.
So good evening, Dr. Natasha.
Yes, good day to you guys. So my part is going to be very short. I think the very important part has been covered by Mike. So my part is I'm going to talk about animal welfare advice during this pandemic.
Okay.
Okay. So you can see my slides, right?
Yes, yes, I'm seeing.
No problem, Nat. We can see them clearly.
Awesome. Okay, great. So very quickly, the next few slides, I'll talk about different advice for vets, for pet owners, and then I'll go through very quickly advice for NGOs and also the governments or authorities. So we start with why is pets important for people? And it's because the main reason is because of this human-animal bond. And it's mainly because of this bond that creates, our career and helps us to be better vets with our clients and our patients. And the human-animal bond, if you look at it, what it is actually, it's a mutually beneficial relationship between people and animals. And it helps to benefit both of them, not only just on physical benefits. I think we all know how it helps humans to have better immunity and better well-being, lower blood pressure and all. But also, very importantly, is that it helps us with our mental well-being as well. So it's not just people, it's also animals' physical and mental well-being as well. So it ties in with animal welfare. So if we can keep our pets to have good welfare, then we will have great human-animal bond with them, and therefore it affects us positively as well. And welfare, animal welfare in this case, is defined as the physical and psychological, social, and environmental well-being of animals. Now, I know this is a little bit difficult to understand, so the next slide I'll explain a little bit more about what animal welfare is. So we need to first understand the difference between welfare and ethics, because a lot of people confuse these two together, and initially even for me as well, it's a very confusing subject to try to understand. But I'll give you this case study as an example in terms of how we can understand this better. So imagine that you have two cats with similar injuries, which is a broken leg, that's come to you in your clinic. The only difference is the owners. So in cat A, the owner maybe hit the cat on purpose until the leg is broken. But cat B, the cat ran away from home and got into an accident with a car. And then both of them are presented to you in the clinic. If we look at just the welfare of these animals, and we look at welfare science to measure this welfare, we can see that actually the welfare for these two cats are the same. So welfare science looks at how the animal is feeling, and we're trying to measure what the animal's experience is like. And I think from veterinary science we learn a lot about pain, and we understand that a broken bone is very painful. So both cats have similar kind of welfare. The main difference in this example here is the owner and how the owner acts, and that is what we call animal ethics. And in this case, it's always good for us to separate it out so that we understand what we are dealing with. And in this case, we really want to look at the animals and what is the best for the animals, rather than telling other people what they should do. But by understanding what is good for the animals, it automatically concerns what people should be doing for animals as well. Now, animal welfare is not a yes or no type of question. It's not a yes, animal has welfare, no, animal has no welfare at all. But it's a continuum. So it ranges from very poor welfare to very good welfare. An example, I would say, is imagine that sadness in people. If you are not feeling sad, it doesn't automatically mean that you are feeling very happy. So same with an animal as well. If an animal is suffering and then you take away that suffering, it doesn't mean that the animal has good welfare. It might be somewhere in the middle with neutral or adequate welfare, or what we call a life worth living. So the whole point of getting animals to feel more positive experiences is the whole point of animal welfare, and trying to bring it into a positive side so that the animal can have a good life. So in short, what are the things that we need to do to ensure that the animal has good welfare or a good life? 5 animal welfare needs. This is the most basic of all the animal welfare lesson for us to understand 5 animal welfare needs. Now, I'm not going to go into detail into all that 5, because you can download our guidelines that we have written from the website. So we can go to WSAVA website and find for animal welfare guidelines, and it details what you can do in your practice, in your clinic, for all these 5 different animal welfare needs. Now, we are talking here about this pandemic. So what is the difference in your clinic in terms of what you're going to do for the animals? First of all, we need to ensure that one of the things that affects us in the practice is how much equipment, personal protective equipment, drugs availability is available for vet practices. So a lot of times the advice comes down to only offer essential veterinary services. And this is very important to maintain the animal's health, and of course, a lot of times it's life and death situation that we need to attend to, but we also need to understand that we should, by right, include into it anything that is really critical for animal welfare, that is affecting its welfare and is giving it a lot of suffering or poor bad welfare experiences, or anything that for example, making the animal feel a lot of pain. So those things and things that also can affect the human-animal bond as well should be classified as urgent cases and should be listed down in essential veterinary services. So throughout the whole lockdown, we still can ensure that animals should have good welfare. The other main thing that's different in a lot of practices during this pandemic is now everybody is practicing social distancing and also hygiene, like washing hands especially. And washing hands really should always be there, whether you are handling other people's pets or having that contact with other humans as well. But it's also one of the advice that you can also give to a lot of pet owners, especially if they themselves are sick, that they should maintain good hygiene by washing hands before and after touching their pets, or before and after feeding their pets as well. Now in the clinic, with all these things being practiced, we need to really focus to try to reduce stress and anxiety in all these animals that are coming to us in practice. So we can do things like reducing the amount of time that we need to diagnose and treat those animals, or even keep them in the wards in the hospitals. How you handle those animals would be very important, especially that maybe only one owner is allowed to go in, or maybe even not at all going in, so that animal's familiarity with people is not there. It makes them a bit more anxious. So we need to try to reduce all these things within our practice in terms of what we can do in our practice. And one of the things that is important is handling of animals and how to make a fear-free environment. So we can Google up fear-free practices, and there's lots of resources there for us to teach us, vets and vet practices, how to make it a fear-free environment. But fear-free also have lots of resources for owners at home, and also for shelters as well, so people who's dealing with a lot of different animals. So do check it out. Now, the time that an animal visits the clinic is maybe less than 1% of its life. Most of the time, they're going to be staying at home. And home is where it affects the welfare the most. So that's why we have lots more advice, and it's more crucial for us as vets to educate pet owners in terms of how they can treat their animals at home. And in times of this pandemic, a lot of times we are all locked down at home with our animals. So we need to make sure that we are first, I mean, when I say we, means pet owners need to be prepared to make sure that there's adequate food, adequate pet supplies, that is, for example, cat litter, and if the animal is on medication, to ensure that there's enough medicine supplies, and also contact your vets to get enough supplies in the future for the entire duration of the lockdown. Now, this is probably more essential at the beginning of the pandemic than in the middle or towards the end of it, but it's still a good reminder to get people to understand how important it is to maintain good welfare for the animals. Also, the other advice for people at home is to have a backup plan in case that the owners fall sick. Is there someone else that can care for the cats or for the dogs? Is there somewhere that they can actually put the dogs temporarily or pets temporarily while they recover themselves? So we need to have a backup plan as well. Now, the main thing that affects welfare of animals at home is a big change in their environment or in their routine. So we need to understand that while we are all locked down at the same time, we need to try to maintain routine. Try to have something that's on schedule. So for example, feeding times, time for, to bring the dog for a walk, to go to the toilet, or to exercise or play time with the animals should be scheduled and should follow roughly around the same time every day. So we create that routine on the animals at home. The other important thing at home is to create a space where the animal can feel safe. So to create a space where the animals can go and hide if they don't want to interact with you or any other people that's locked down at home, they want to have their own me time. So, and it doesn't have to be a whole room for the entire animal. It can just be a quiet little corner, and make sure that nobody disturbs that animal while it's resting away from people as well. The other thing that we need to consider with people, especially with kids and dogs that's locked down at home, is safety. And this, I'm talking specifically about trying to prevent dog bites, especially for children. So we need to educate kids and parents, of course, how to identify body language of dogs, when to touch them and when not to touch them, so that we can avoid dog bites and potential harm at home. And the other main thing about staying home with your pets, especially if they are now not allowed to go out as frequent as much, or maybe not allowed to go out at all anymore. So we need to come up with some ideas and things that we can do to entertain pets at home. It doesn't have to be 24 hours a day, but you create that routine and maybe spend a couple of minutes, maybe an hour or so, depending on you and your pet really, to get that entertainment at home. So these are some ideas that we can do at home. Like for dogs, we rotate different toys every now and then, use a puzzle feeder to give food for the dogs. Training and obedience is actually a good example of how not only you can establish a good human-animal bond with your pets, but also it's a good engagement tool and also a good time to actually enrich them while doing the training. And of course, there's exercise as well. For cats, it's important to make sure that they have enough resources. When I'm talking about resources, that means litter trays, enough space and hiding spaces especially, or places to rest, and enough places for them to scratch. So all these resources should be enough for the cats, especially if you have more than one cat. So you need to make sure that there's enough for them, for all of them. Cats need their own playtime as well, and if they are really stressed up, you can consider using a pheromone diffuser. So Fairleeway is a very popular brand pheromone diffuser that we can use for cats. Now all of these and more ideas is elaborated in the guidelines that I will talk about at the end of this presentation. Just to go through very quickly, for vets especially that's working outside of your vet practices, especially in the shelter, some of the things that you can do for animal welfare. Now in the shelter, maybe you want to try to reduce the amount of animals in the shelter space. So fostering is actually a very popular option, and it helps people to get time and get a little bit more attached to the animals as well. So it helps with the adoption process. Some shelters can be still open for adoption if you follow safety procedures, such as following the social distancing. Try as much as possible to do things over the phone or over maybe an interview through teleconferencing like this. So as much as possible, avoid contact with humans. But it's still possible to have some adoption programs going out. Some of the organizations might be doing some outreach work, like say, for example, a vaccination program or a spay and neuter program for animals that's roaming around the streets. Well, we need to understand the criteria or the situation in your area or in your country, and whether there's enough drugs, whether there's enough PPE, whether there's enough, whether there's a high risk of people walking around and looking at what you're doing before you eventually decide to do or not to do. So a lot of times we might need to stop a lot of these activities temporarily, and we boil down to only the essential outreach programs that's needed in your area. Now, maybe by the end of this lockdown period, there might be also a change in animal welfare priorities. So we need to reconsider again what your organization is doing and whether it's actually addressing the animal welfare issue. So maybe, for example, at the end of the period, maybe a rabies outbreak is more of a priority, or maybe animals that's facing malnutrition is more of the priority. So we need to really reconsider again while we start back our work. Just very quickly, what are the animal welfare concerns during this pandemic? And it's not just concerning NGOs, this concerns vets as well. I'm sure a lot of you already have seen some sort of abandonment that's happening. And this could be because, people don't understand, people are fearful of the animals, but it also can be because people's reduced ability now to take care of their pets, so whether they're sick or doesn't have that financial capability anymore to take care of their pets. The other concerns that we need to consider is the risk of mass culling or killing of animals on the streets, especially for the stray or free roaming population, because it might seem that there's more animals roaming around, especially since that now a lot of times their food source, their main food source has been cut off, so they might need to wander around to search for more food. You might also get some euthanasia requests in your practices, especially for people who is a bit scared and a bit afraid of what's happening with their pets, don't understand. You need to make sure that they understand that euthanasia is not the only options that they have, although euthanasia can be used to relieve the welfare of animals, but euthanasia might be just one option. They can look at other options like getting the animals fostered temporarily or finding new owners to adopt the animals from them. So a lot of these welfare concerns stems from a lot of misunderstanding and fear. So the next thing is what vets can do. So we can advocate for animal welfare by firstly trying to educate a lot of people about animal welfare, not just our clients, but we can educate other people or give advice to other authorities or the government, for example, on what is welfare and how we can actually maintain good welfare for their animals. We need to make sure that we voice out and make sure that animals are able to get their food, pet owners are able to get food, supplies, medicine, and access to vet service when it's needed. We need to try to keep pets and owner together as much as possible, because the separation would create that anxiety and we don't get that benefit from that human-animal bond anymore. So as much as possible, keeping them together will reduce their anxiety and increase their welfare. Dogs would need access to get exercise and maybe opportunities to go for toilet outside. So if you are if you're advising to the government, maybe you should allow pet owners to walk their dogs. Of course, it has to be done in a very safe manner. So keep that distance with other dogs and other humans especially. Make sure that they have adequate distance between them. And of course, hygiene is very important. So wash hands before and after touching your animals. Now, as I mentioned earlier on, there might be a lot of animals, stray animals or free roaming animals where their normal sources of food has been cut off because maybe the restaurant's not open anymore, or the marketplace has been shut down. So they're all roaming around looking for food now. So the other advice is we don't want them to roam around too much. So if people are already they understand, they know the animals in the area, they recognize those animals and they are concerned for those animals, we should allow them to come out and give food and water for those animals. But of course, again, it shall be done in a safe manner. So as much as possible, don't do it, you know, in a crowd with a lot of people. Do it in one or two persons. Maintain that social distancing, and of course, maintain good hygiene as much as possible. Now, I know I said a lot, but there's a lot more for you to read. So in terms of animal welfare advice in times of COVID pandemic, you can go to this website, the WSAVA COVID resource package, and you see there's a lot of resources on that website. So Michael Lappin has just showed you what it looks like at the top. If you scroll down to the bottom, there's this place for animal welfare advice, and we separate it for advice for pet owners, organizations or NGOs, and then for governments and authorities. So do download this and then spread the news as well to relevant people. That's it.
Thanks a lot, Dr. Natasha. We're happy to listen to you, to your valuable information. It was very amazing information. Thank you very much. And hope to see you also in Egypt very soon, and going to Pyramid and Khan al-Khalili. I will invite you to visit all Egypt very soon, and we will reconnect very soon after Corona.
Dr. Chen.
We're going to Dr. Chen.
Just briefly, yes, I'll just put my screen up.
Yes, of course.
Because there's been a couple of questions about membership in the chat room here. On the WSAVA website, and I'll show you the link to WSAVA in 2 slides' time, there is information on the membership categories and how you can join. So I suggest you go to the WSAVA website. All the information you need to join is there. And as I said, we don't currently have an individual membership, so we need an application from an association or a syndicate or whatever it's called, and the information is there and you can figure that one out. Another very important thing, we have to thank the people that support WSAVA, and MSD Animal Health support both continuing education and the One Health Committee, and we thank them for that, and Purina Institute support the One Health Committee and also the Animal Welfare and Wellness Committee. So they are 2 of our very important sponsors. So I'd like to just thank them for their support and continued efforts on behalf of WSAVA. And lastly, that's the WSAVA link, the big one up the top. If you go there, you can find all the other subsidiary links there, and the specific link, which has been up a number of times today, is that one on coronavirus, and you can find that quite easily from the home page. So that's all I needed to share with you, and I thought we can get out of that.
So anyone, thank you, Dr. Shane. Anyone wanted to ask questions, send it for me on chat, private, and I will ask it for Dr. Shane. So I will collect the question, and all our speakers are ready to listen to your questions. So I am waiting for your questions. Dr. Chen, he asking me the first question that there is any data about case number 0 in COVID-19?
COVID-19, I wish that's a big thing. They don't know yet. There was something reported today, and Mike will probably know more than I, but they still don't know exactly the original source of SARS-CoV-2. They believe it was a bat, but they also think there was an intermediate host, and they don't currently know what that was. It appears that it wasn't the pangolin, as originally thought. So the pangolin is off the hook, shall we say, but they don't yet know how it jumped from one species to another. Mike, do you have any comments?
No, just that same information, Shane. I don't think we know yet.
But for all evidence that we have, it started probably in a wet market where you have a mixture of live animals, both domestic and wildlife. in close proximity together. And I don't know if any of you have seen one in Asia. They can be low on hygiene, shall we say.
Okay, there is a question for Dr. Lappin. Is there any mutation in isolated viruses in dog and cats or cats?
Yes, that's a great question. We don't have enough information from dogs and cats individually to compare them yet. There's a little bit of, say, it's pretty solid, human to human, secondary host, dog, cat, ferret, and not any new excitement that I've seen that is going to jump hosts or become more or less pathogenic in the dog or cat.
Okay. Asking Dr. Lappin, if people shed after recovery and for how long?
Yes, that's the really important question is if we're a recovered person, when and if we become susceptible again. And honestly, we don't know the answer to that question yet. I can share with you some unpublished data in cats that's coming from Colorado State in about 2 or 3 weeks. But if experimental infections are induced, like the one that I showed you earlier today from New England Journal of Medicine, and then also our friends in China, we have some data coming, not from my lab, but from a colleague, that shows good solid immunity on re-challenge at day 28, just from a cat that has made it through an experimental infection. You cannot reinfect them on day 28. So hopefully that's evidence that all mammalian species, would have some partial protection. And obviously there's so many vaccine trials going on right now. I think we'll have exciting new information coming quickly, especially even by the end of 2020.
Okay. What are the side effects to recovered COVID-19?
Yeah, that one's to me. For dogs and cats, the ones that have become ill have seemingly been self-limited, and mainly vomiting, diarrhea, coughing, sneezing, perhaps ocular discharge. We have a study in my laboratory right now as well, so hopefully using cases in the environment, hopefully we'll be able to give more information about the natural course of infection. But if it's an adult cat or an adult dog, when given a large dose of the virus, clinical signs don't occur at all. And so right now, I would say there's no evidence for a long-term clinical illness, which is why ISCAID feels if they've had regular respiratory signs, it's probably a cat with herpes. If it's a dog that's coughing, it's probably Bordetella, not this virus. And if those clinical signs have lasted for 14 days or longer, it's also probably not this virus. So that's one of our decision trees in our hospital, is if they've had respiratory or gastrointestinal signs for longer than 14 days, we do not believe that it's this virus. Within 14 days and from a known sick household with sick people, then we do wear our full PPE because there's short-term shedding potential.
Okay. So, Dr. Lappin, what do you mean by reverse zoonosis?
Ooh, can you restate? We broke up a little.
That's right. I'll grab that, Mike. A reverse zoonosis is a disease that is passed not from an animal to a human, but from a human to an animal. And it has another name too, called an anthropognosis, which means that the human is the source of infection to animals. So in this case, the animal gets infected because of a human infection, and as Mike has well described and explained here, that animal appears to be a dead-end host in most cases. It doesn't pass back to humans, but it doesn't even pass to other animals unless in highly experimental circumstances.
Okay. There is a question that asking about ACE inhibitors or ACE receptors, if it protects dogs from COVID-19.
Yes, that work with the ACE2 receptors do show that ferrets and cats are a little bit more receptive to this virus than dogs.
Okay.
There's a question for you, Natasha, about how to make an animal comfortable during examination in the clinic.
The main thing about an animal, to make that animal comfortable in the clinic, is how you handle that animal. So you make sure that there is no sudden movement. If you need to restrain the animal, try to do it as gently as you can. You try to do everything as gently as you can before you move on to a more firm type of restraint techniques. So small things like if you have a big dog, don't lift the dog up to the table. Bend down to examine the animal. If the owner is there, let the animal take their time to get to be comfortable in your examining room while you question the pet owners for this history. So it's small tips like that. If you want to know more details, the animal welfare guidelines is probably the best for you to download and have a look.
Thank you, Dr. Natasha.
Mike, there's another couple of questions about other animals, and maybe you can answer this. One was about wild birds, whether there's any spread, if they're involved in any spread of COVID, novel SARS-CoV-2, and also another question relating to horses and other ruminant animals. Are they being checked to see if they can spread the disease amongst themselves or to humans?
There is a question, Dr. Chen. There is a study in China confirmed that cats infected by within COVID-19, and it also confirmed transmission of infection between cats through airborne way.
True.
The question is,
so Mike, the question was about horses and other animals other than cats and dogs, in effect.
yes.
Yes, that's a really great group of questions. I was just following the chat there. Again, birds seem to be quite resistant. The farm animals studied so far, especially the pig, has been quite resistant. I'm not familiar with horse data yet, but we've had no buzz on the internet of horses becoming infected. But farm animals and birds right now, we at CSU, we focus on has the owner been sick type questions, because we do want to lessen human-to-human transmission. And most of our trying to avoid the animal transmission has been focused on the cats and the ferret, just because of a little bit higher susceptibility. But we do remind people that dogs, cats, ferrets don't become infected spontaneously. And so those that are owned by known individuals, it's really important to have that history from the family, because that's most likely how an animal would become a transient carrier. And then I did notice a little bit about the clinical signs came up on a couple of the chats. Again, in the experimentally infected animals, they have been quite mild and self-limited, and that's even with high dose. And that's what we've seen with that handful of cats from nature and the handful of dogs that have been confirmed to be positive, is that just a mild self-limited disease. And so if there is an illness associated with this virus in our companion animals, it will probably be short-lived. And so I noticed a euthanasia question. As long as they can be safely sequestered within the hospital, or preferably at the home where they became infected, that should be, it should be over in the very short term. No evidence for long-term shedding so far in companion animals.
There is a question for Dr. Natasha. What other ways for treating ill animals other than euthanasia?
Right, that's a very good question. And I think I have one more privately asked question about what is euthanasia. So I want to explain that euthanasia is defined as a good death. So what you're doing is you're assisting the animal to die by giving an injection, usually of an overdose of a type of anesthetic. So what you're doing is you are killing the animal in a very humane manner and as least painful manner as possible. So what do we do with animals that needs euthanasia, but is, you know, what other options do we have for animals that needs euthanasia? We need to understand whether there's chance to recover or not recover, or whether it will go down badly. So for example, in case of rabies cases, we know that once they within the next 10 days and they will suffer immensely the next few days, and still eventually they will usually die. So in those cases, euthanasia is normally the best option to relieve that animal's suffering. And then the other options that you can do for other animals that are in pain but you don't want to euthanize, or the owner refuses to euthanize, is to find other ways to relieve the animal from suffering. So giving a lot of pain medication is the next best thing that you can do.
Okay. There is another question for you, Dr. Natasha. Do you think it is important to have the owners in the examination room to reduce pet anxiety? As with the current circumstances, vet clinics are shifting to taking e-consults.
Usually, pets respond much better with owners in the room. It helps that there's somebody familiar in the room that they can, you know, help to calm themselves while you're trying to do the examination. But there are some animals that, especially for dogs, that become a bit more aggressive when the owner is in the room. So you really have to understand how to read animal behavior and think about whether you need or not need to have the owners in the room. But most of the time, having them in the room is a much better option for the animals.
Okay, and there's a question for Dr. IP. What about IP vaccine in poultry? Can be useful in the COVID-19?
If that's about the use of either the dog enteric coronavirus vaccine or the FIP vaccine that's available in some country, there would be no benefit to trying to lessen SARS-CoV-2. And so the Vaccine Guidelines Committee does not recommend vaccinating dogs or cats with those vaccines to try to lessen this virus. It would be ineffective. And I did see a couple of the other questions about clinical illness. There is no known specific therapy for this coronavirus, just like the other coronaviruses right now for pets. But it does look, even in the high-dose experimental animals, illness is minimal and self-limited. And so sequestering or safety at home with the owner, just like you would, stay away from the other family members. Hopefully, if there is any mild respiratory or GI, gastrointestinal disease in those pets due to this virus, they apparently should be self-limited with the data that we have so far. So really no evidence that I know of, Shane, that there's any chronic shedding or disease syndrome. Ferrets might shed a little bit longer than cats, who shed a little bit longer than dogs, but no evidence of chronic disease. And so if you're seeing those animals with vomiting, diarrhea, coughing, or sneezing that have been that way for longer than 2 weeks, it's probably not this virus. It's probably their regular viruses.
Okay.
Thank you, Dr. Michael. Dr. Natasha, there is a question about what is the hardest experience you had ever?
Hardest experience?
Experience with an animal.
I think euthanasia issue is always the hardest experience for not just for me but for any vets to make that decision or to talk to the owners and to tell them the bad news. That's probably the hardest experience in dealing with animals.
And what do you recommend reading on vets' behavior?
In animal behavior is a big course. It's not so easy to just ask you to read 1 or 2 documents. But there are lots of courses on animal behavior out there. So maybe I can compile a few and then pass it to the host, and he can share it with everybody here.
Okay.
I just think maybe, Dr. Mohamed, that maybe you can collate the rest of the questions and perhaps send them to myself, and I can pass them to Dr. Lappin and Dr. Lee, and they can perhaps respond to them as we go on. There's probably 1 or 2 more that we can do before we run out of time. We only have a couple of minutes left, and if there are any extra ones, maybe if you can send those to me and I can pass them on to the speakers, and they can respond when they can, and I will send them back to you. Okay?
Okay.
Maybe another couple of questions and we can finish up.
Yes, the last question for you, Dr. Shane. Can any vet join WSAVA or just organizations?
Only organisations at the moment. We have been looking at the possibility of having individual membership. That hasn't been decided yet, but even if it was an individual membership, we would be looking at you joining an international association of people who weren't affiliated, but that has not been worked out how that would work. We might vote on that this September, but we don't know yet. So currently what we would ask you to do in Egypt is work with a veterinary association, or if you do not have one, a companion animal one, establish one. And we could even help you do that. And then you can join WSAVA.
We can do from the syndicate, the veterinary syndicate.
You can, and there is a link on the WSAVA webpage where you can find out all the documents that you need. There are requirements for that association, so you need to read through all of those to make sure you meet those requirements.
Dr. Shane, you mean that association is for vet animals only or for veterinarians?
For example, in Singapore, our association is for all veterinarians. It doesn't matter whether they are large animal veterinarians or small animal veterinarians or research veterinarians, because we only have a small number. But usually, if there is a companion animal association, we prefer them to join.
Okay. Thank you a lot, Dr. Shane. Dr. Shane, and we are most welcome to listen to you. Thank you, Dr. Michael Lappin. Thank you, Dr. Natasha. We was very happy with you. See you soon in Egypt.
Thank you very much for inviting us, and I hope you enjoyed it. And
we are very happy.
And, please keep in contact. And Mike and Natasha, good job, guys. Thanks very much.
Be glad to do the follow-up questions.
See you guys.
Thank you.
Bye-bye.
Thank you.
Good night.
باي باي باي. احنا مكملين معاكم، خليكم معانا. احنا دكتور مايكل لابين ودكتور ناتاشا ودكتور شين خلصوا. احنا عايزين نسمع تعليق دكتور هيثم فرغلي. معانا دكتور هيثم على التوبيك. دكتور هيثم ازي حضرتك؟
ازيك يا دكتور محمد؟
ايه راي حضرتك؟ عايزين نسمع راي حضرتك في الويبينار.
طبعا كلام جدا، طبعا الناس محترمه جدا طبعا. الكلام طبعا برضو زي ما كلام العالم كله بيقول ان القصه لسه ماسكت شويه برضو، عشان ما ناخدش قرارات حاسمه على الموضوع دلوقتي ونتعامل مع القطط والكلاب ان هم سورس اوف انفكشن، لان الخطوه دي خطوه مهمه قوي في الحسابات.
تمام.
لان مستقبل المهنه بيقف على كلام يعني مسؤول المفروض. ان احنا لسه ان احنا نعتبر القطط والكلاب مصدر للعدوى دي قصه كبيره جدا. حتى الابحاث اللي معموله ابحاث تعتبر نسبه قليله جدا بالمقارنه بالابحاث اللي بتتعمل على مستوى العالم.
تمام.
مش الحاجه اللي تخلينا ناخد الريسك بتاع، لان اول ما ظهر القصه دي ابتدت الناس ترمي الكلاب والقطط في الشارع، وده كان حاجه مش مظبوطه. يعني قرار بدري قوي. هو احنا نطلع بكونكلوجن بس من القصه دي ان احنا نبدا ناخد خطوات الاحترازيه في التعامل مع القطط والكلاب زي ما بنعمل خطوات احترازيه مع البني ادمين.
تمام.
يعني هي دي النقطه الاساسيه في الكلام يعني.
تمام.
انما طبعا يعني بصراحه حدث محترم والناس محترمه جدا ان احنا الوسابه بيتعاملوا معانا هنا. يعني حاجه ضروري كنا نبدا نعمل ايفنت زي كده كذا مره ان شاء الله، وفي مواضيع كتيره يعني مش بيت بس، لان هم مرجعيه في قصه البيتس في العالم كله.
طبعا.
ربنا يكرم ان شاء الله ونكرر كذا مره ان شاء الله الحدث ان شاء الله.
احنا ان شاء الله يعني في بروميس من الزملاء ان شاء الله هنكرر الحدث مع الوسافه، وهنحاول ان احنا دايما نخرج بره الصندوق نقدر نوصل معلومه بشكل مختلف لزملائنا الاطباء البيطريين. ودكتور هيثم برضو ان شاء الله عايزين نرتب مع حضرتك مواعيد محاضراتنا مع حضرتك الجايه ان شاء الله. برضو ممكن تبقى يعني جزء منها ريليتد للايفنت بتاع النهارده، وان شاء الله يبقى في سلسله من توبكس مفيده لزمايلنا الاطباء البيطريين.
ان شاء الله. طبعا ده شرف ليا ان انا اشارك مع النقابه، ده بيتنا كلنا يعني، ده احنا نتمنى نساعد في اي حاجه. وطبعا زملائنا دول حبايبنا، يعني الواحد يتمنى ان هو يقدر يبقى معاهم في اي حاجه ان شاء الله.
شكرا دكتور هيثم جدا والله، نشكر حضرتك. معانا دكتور محمد نبيل برضو زميلنا. انا حابب بس اشكر باسم فيتسومان اكاديمي. تسمعنا يا محمد؟ صوتك بيقطع بس.
معلش عايزين نسمع دكتوره رولا. سامعني؟
اتفضلي يا دكتوره رولا.
دكتوره رولا اتفضلي.
اولا مساء الخير على الجميع، انتم سامعيني اوكي؟
سامعيني.
مساء الخير. طبعا انا بشكر زملاء الدكتور محمد اشرف والدكتور محمد نبيل على التنظيم الرائع، وهذا طبعا مو بغريب على مصر وعلى نقابه الاطباء في مصر والزملاء الافاضل. وبشكر حتى الدكتور هيثم على المحاضره الحلوه وعلى الجروب طبعا وسافا، واتمنى فعلا ان مصر تكون عضو في وسافا. احنا دولة الامارات اصبحنا اعضاء معاهم من 2017، وبالعكس في استفادة كبيرة لوجودكم معاهم، لان من ناحية طبعا حضور المؤتمرات الكونتينيوس اديوكيشن اللي هم بيقدموه الكوميتي اللي ممكن تدخلون فيها، وخاصة بخبراتكم يعني ما شاء الله تقدروا ان انتم تثبتوا وجودكم في هاي الجمعية. ثاني شيء بخصوص موضوع الكوفيد 19 والبيت انيمال، حابه بس انقل لكم احنا يمكن تجربتنا في الامارات مع البيت كلينيك كجهات رقابيه. فطبعا في بعض الاجراءات الاحترازيه اللي احنا طلبناها، واللي بعض حتى العيادات اصبحت ان هي تسويها بصوره اكبر. يعني مثلا في العيادات اللي هي اصبحت ما تستقبل الكلاينت كاشخاص، انما هم ياخذون من الحيوان من خارج العياده ويعالجونه وبعدين يسلمونه لصاحب الحيوان. اذا اضطر ان صاحب البيت نفسه يدخل، موضوع التباعد طبعا الجسدي موجود، حاطين علامات على الارض، حاطين تعليمات خارجيه حتى خارج الكلينيك انها توضح للناس الاشتراطات والاجراءات اللي لازم ياخذونها. بيمنعوا دخول الكلاينت اذا مش حاطين ماسك ولابسين جلافز، طبعا هاي بيمنعوها منعا باتا يعني. فالاجراءات موجوده، حتى احيانا في سيرفي من خارج البوابه للاشخاص اذا كانوا مثلا كانوا كونتاكت مع مصابين عندهم اي اعراض مرضيه، على اساس حتى ان ما يتم نقل المرض ممكن لا قدر الله اذا موجود، لان في ناس ممكن ما تظهر عليهم الاعراض، ممكن يكونوا نقلوها للبت، وفي نفس الوقت هذا البت بيروح عياده، العياده هاي فيها انواع اخرى وحيوانات ثانيه. فاحنا بنراعي هاي الاجراءات، وفي حتى الجهات اللي ممكن تخالف الاجراءات الاحترازيه احيانا يتم اغلاق المنشات. فالحمد لله يعني وصلنا ل يعني ما في اي حالات بالنسبه طبعا للبيت انيمال، عندنا موجوده، الاجراءات موجوده، حتى الدوام اصبحوا يخلوه شفتات، يعني حتى شفت الصبح ممكن ما يشوف شفت اللي بعد الظهر، بحيث انهم برضو يقللوا عدد فبس حبيت انقل لكم يعني هاي التجربة عندنا، وشكرا جزيلا، وان شاء الله يكون طبعا في تعاون اكثر في مثل هاي المحاضرات وهاي الاستفادة. شكرا.
ميرسي جدا دكتورة رولا، وسعيدين بيكي وبالتعاون معاكي ومع دولة الامارات العربية الشقيقة، ودايما بنقول دكتورة رولا نص مصري ونص اماراتي، يعني الميكس الجميل اللي بنحبه دايما. ميرسي لحضرتك جدا وتعاونك معانا.